There's a few pitfalls out there when commencing a low carbohydrate diet, and I want to run you through a very brief video that outlines the things to look out for. So the right actions to get you on track quickly with a low carbohydrate approach are outlined here. The first and most important component of starting a low carbohydrate diet is to set up your environment to save your willpower. Habit formation and management is especially important in changing diet behaviour. We're all programmed by habits which form as quickly as a few weeks after starting something new. And after this time, low carb food choices can become automatic, but you still might need to manage old habits and cravings. Neurobiological research shows us the best way to do this is to identify common triggers for bad eating habits and then aim to replace them with new behaviours to reset your neural circuitry. Shopping is actually much easier on a low carbohydrate diet. This is an example of an Aldi store layout, but other grocery stores have a similar, if not more complex layout. Now this demonstrates that you actually get to avoid a lot of the middle aisles when shopping and get to stick to the refrigerated foods plus some limited fruit and veg. And yes, who can This demonstrates you get to avoid all the middle aisles when shopping and simply can stick to the refrigerated foods plus the limited fruit and veg. And yes, who can resist the special buy section at Aldi? Shopping is actually much easier on an LCHF diet, and this is an example of an Aldi store layout, but other stores are quite similar, and it demonstrates you get to avoid all the middle aisles when shopping. Simply stick to the refrigerated foods plus some fruit and vegetables. And yes, who can avoid the Aldi specials section? Now, willpower is a limited resource, and saving your willpower means eliminating as many temptations as you can. Willpower is impaired under times of stress or sleep deprivation, and it's recommended that sleep hygiene and stress relieving principles also be applied to improve your willpower and success. It means if you're going to eat this way, you have to have the support of those in your household. You have to set up food choices based on the low carb list and good understanding of where the carbohydrates might be hidden. Eliminate temptation by removing those foods from your home. And if you're consulting health professionals, it can help bring your partner along to ensure that you're both on the same page. Counting carbohydrates. We really should be aiming for under 25 grams per day using a way of monitoring this, such as a food diary. You need to be honest and scientific about your carb intake. Calculating your carb intake using internet searches or apps like Carb Manager and the Induction Food Diary is a great way to transition to LCHF. The diary will help you find any carb traps and do LCHF properly your way. Common traps are seen in the next few points. Now, calories matter, but we don't need to count calories using a low carbohydrate lifestyle because the changes in food quality, satiety, and satisfaction allow us to achieve a calorific deficit naturally, without too much effort and hunger. This is what makes it an attractive long-term lever for metabolic health. Cut out all sugar. There are a lot of different names for sugar, and food labels can sometimes obscure the true sugar content this way. But remember that curries are often heavily filled with palm sugar, like Thai curries and some Indian curries, and most fruits contain fructose, which is nature's way of fattening us, and probably the worst choices are bananas and stone fruits. Tart berries are a good choice in small quantities, like strawberries, raspberries and blackberries. Blueberries, apples and oranges are also higher in their total carb load. Treat fruit as natural candy, and it needs to be eaten sparingly. Wherever in doubt, look at the total per 100 grams of carb. It's also important to note that vegetable oils are known to be easily oxidized and can contribute to poor metabolic health. So wherever possible, those oils and fats should be reduced and replaced with minimally processed natural sources of fat. Increasing your salt intake. Now you might find that you get headaches or become lightheaded with exercise or getting up too quickly when you're on the low carbohydrate diet. Dry eyes and constipation can occur, and this is largely because your kidneys start to adapt to lower insulin levels, which leads to more salt being lost in the urine. Now this loss comes with water loss, and it leads to reduced blood volume. If you're on blood pressure medications, you should be seeing a doctor to monitor this, as it might mean you no longer need them or need to reduce them. Now this is called the Atkins flu. It's highly predictable and totally avoidable if it's anticipated in the early stages by deliberately increasing salt intake for the first fortnight. The common methods include miso soup or other broth, eating saltier meats, or aiming for an intake overall of about 7.5 to 15 grams of salt. That's 4 to 6 grams of sodium. You might need to supplement magnesium as well, but this is usually less essential. Eat to appetite. The signals that our brain and gut provide us when eating a high-carb, sugary diet can easily cause a state of confusion between cravings and hunger, which are totally different. The reduction in appetite that occurs on a low insulin state whilst eating low carb is the main reason for reducing the calorie intake, and hence the weight loss that we see. Therefore, to harness this reduction in appetite, it's important to respond to know the difference between hunger and cravings. If you would eat a savoury low carbohydrate food, then you're most likely actually hungry. If you would only eat a sweet food like fruit or candy, it's much more likely that you're experiencing a craving. And it's completely healthy to only eat when you're hungry rather than to a schedule. Now most people can eat twice daily on a low carb intake and accelerate their success. But you might find that even when you're hungry, you can stave off eating for a little longer without big mood swings and tiredness. So intermittent fasting and time-restricted feeding can be fantastic tools to combine with a low carbohydrate approach. Once your body's burning fat and you've opened the doors and you're keto adapted, appetite reduces relative to energy intake. And while a low carb diet works by reducing insulin, stimulating ketosis and reducing appetite, the most effective way of reducing insulin levels further once nutritional ketosis is established is through fasting. And that's really when the body is optimized at fat burning. We don't need to eat 3 meals per day. So the advantage of low carb diets is that it addresses hunger via these neurohormonal mechanisms, making fasting much easier. Now the most common way to do this is to leverage your overnight fast by missing breakfast. Coffee with minimal or no milk will often help substitute on a habitual and a behavioural level, but whatever works for you is fine. If you haven't seen the videos from Dr. Jason Fung on fasting, they are a must. All the following statements are sound bites that are easy to hear and repeat, but without context, they're unhelpful and in fact they're misleading. Firstly, breakfast is the most important meal of the day. Well, we should be eating to appetite and not around the clock. There is no essential need for breakfast in the human species, and it's more about a social construct. Most breakfast foods are actually designed to be hyper palatable, and they're often very carbohydrate dense. The next one is that fasting reduces your metabolic rate and slows weight loss. Now, while prolonged calorific restriction, especially with calorie counting, can do this, intermittent fasting minimizes this. And periods of fasting have actually been shown to raise basal metabolic rate. So slowing basal metabolic rate is an evolutionary response to weight loss, which is not a helpful thing in most humans. No matter what we do during periods of chronic weight loss, we will get a slowed metabolic rate at times. So we need to be aware of this and accept that weight loss plateaus occur without needing to have a defeatist attitude. Continuing fasting will continue to assist. The next myth: you should eat small, frequent meals to prevent hypoglycemia. When we take away erratic insulin signaling by restricting carbs, blood sugars stabilize and you have a secondary fuel in the ketones when eating this way. So it's unnecessary and usually can lead to weight gain in most patients. Again, context matters. If you're a bodybuilder training like crazy and trying to gain muscle, this might be a good idea to provide a fairly continuous supply of fuel and the building blocks for muscle. But if your goal is to lose body fat, well, being around multiple small frequent meals all day can really backfire. The next myth, that fasting leads to hypoglycemia. Well, with a low carbohydrate diet, again, insulin signaling improves and blood sugars stabilise, and the ketones can help supply the brain. So in diabetics, fasting can lead to low blood sugar, and medical supervision is recommended. But it's a hugely effective tool in the management, particularly of type 2 diabetes. Now the next myth, it leads to burning of muscle instead of fat. Again, this depends on context. If you're a very lean bodybuilder trying to go from 10 to 8% body fat, it might be true. But when you have ample surpluses of stored energy as fat, it's completely wrong. When keto adapted, fat is burnt as the primary fuel, and skeletal muscle protein breakdown only occurs as a last resort when fat stores are depleted. On a teleological level, it would make no sense for humans to lose muscle mass and therefore their speed and hunting ability during periods of scarce resources. Now, resistance training that fatigues muscle tends to preserve it and increase muscle mass even at the same time that fat is lost. But very intensive aerobic exercise can increase the degree of muscle protein breakdown. Drink water, not coconut water, not juice, sports drinks, diet drinks. Mineral water and sparkling water might make it more interesting, but you really need to enjoy drinking water. Now, if you drink tea or coffee, the milk you have with these can really add up because milk is about 10% carbohydrate. So if you have 500 mils of milk, that's 50 grams of carbohydrate. So good options are short coffees and black teas. And sometimes adding a little bit of cream rather than milk can help. Now, alcohol, well, simply put, your body will burn alcohol before it burns fat. So excess alcohol will sabotage your progress. In the Australian guidelines, it's recommended no more than 10 standard drinks per week for men and 8 for women. And look, even though it makes us relax a little bit, there's no lower limit below which it's considered safe to consume alcohol. In other words, any alcohol increases the risk of important health conditions, including cancers. So if you're going to have a drink, best options are scotch, wine, gin and soda, and very low carb beers. Now lastly, liquid meal replacements work for acute weight loss, and they might have a role when weight loss is needed rapidly, but virtually all patients regain the weight. And you see the sugar content in most of these drinks is really high, 10 to 20%, which can't be good for the liver or visceral fat production, even if you do lose weight acutely. Now, your ketones. These are a great biomarker and they'll help keep you honest because ketones are exclusively produced from the breakdown of fat. Now, the goal there for ketones is over 0.3 millimoles. Probably 0.5 is ideal, but that indicates that you are burning fat. Now, everyone's individual and some people have higher or lower thresholds for starting to drop their insulin levels, but virtually everyone will be able to achieve ketosis by staying under 20 to 25 grams of carbohydrates for 4 to 6 weeks. And once you're keto adapted, you'll burn fat as your primary fuel and you'll make ketones. Now, if you're in the induction phase, it's recommended you invest in a blood ketone monitor to measure your body's adaptation and find out how to maximize your fat burning. Measuring after dinner or at a time through the day where you're fasted can give you the highest levels, and that's the time you should consistently measure at. In the first week, you'll lose water and glycogen in the muscles, which it's normally replenished with a higher carbohydrate intake. So this weight loss is less important than the fat loss you achieve when you continue this way for months. And sometimes measuring body composition via a DEXA scanner, it can assist you understanding muscle and fat components. But the important thing is that you check your overall health markers, waist circumference, blood markers of health. And a continuous glucose monitor is an outstanding tool to understand your metabolism, provide insights, and personalize your diet. I've got a separate video on each of these biofeedback tools and how they can complement your progress. Forgive lapses, but learn from them. . This is key because what we're doing here is changing habits. Understanding the components of a healthy lifestyle is one thing, but acting on that knowledge consistently is another. You're human and your brain is wired to seek reward from pleasurable things. Your brain's reward pathways are found in a place called the ventral tegmental area. Now, the reward pathways explain sugar cravings and addiction. The nerve cells or neurons here are intimately linked with parts of the brain that serve pleasure, memory, action, and vision. They produce a neurotransmitter called dopamine, which strengthens the associations between all these areas. And all these linkages mean that when you eat something pleasurable, your brain remembers the context and the situation and aims to seek it out again. For example, if you go to the beach on a sunny day and eat an ice cream, the next time you're at the beach on a sunny day, you might find yourself craving and instinctively looking for ice cream. Now, these associations become triggers for cravings or seeking out food. And it can be demonstrated on functional MRI as all these parts of the brain light up when people are shown images of sweet, sugary foods. And every time these parts of the brain fire together and produce dopamine, they strengthen their association. And this is what's called neuroplasticity, which works very much like water flowing down a sand mound to produce a turret. The more water that flows, the deeper that little cavity becomes, or canal becomes, and this is the path of least resistance. Now, we can't easily disrupt that process, but we can create a new pathway or a new canal as preferred behaviour. So each time you have a lapse on a low carbohydrate diet, it helps to examine the factors that precipitated that lapse and learn from it and choose new habits in the future to rewire yourself. If you're on medication, particularly for diabetes or high blood pressure, you'll need a regular review to prevent side effects such as low blood sugar or low blood pressure. This can be done in collaboration with your GP or the doctor supervising you on this diet. Once you have the hang of a low carbohydrate lifestyle, there are a few other helpful tools that can be added without throwing on too much extra effort or stress. This is because your insulin levels will be reduced and your appetite will follow. Low carb is a great foundation. Then you can consider making further efforts in other aspects of intermittent fasting, a targeted exercise regime, specific medications and supplements as professionally directed, and these can amplify your results. As a sport and exercise physician, I have the authority to say that exercise is not a great way to lose weight on its own because it often drives appetite. So the focus in the early stages is to avoid the harms of inactivity and focus on getting your diet optimized, one thing at a time. Your body has the ability to use both glucose and fat for fuel, kind of like a hybrid vehicle, fat, glucose. And the body is inherently good at using glucose for energy. But when we improve the ability to burn fat for fuel as well, we call this increased metabolic flexibility, and it's a very important health asset. But once you're set up on your diet, the system needs to be challenged to adapt further, and exercise helps you achieve many important physical and mental changes. So that is something that we certainly introduce in time. I hope you found this video useful. I create these educational videos to help empower patients by allowing them to understand their problem, treatment options, and the expected recovery. Please remember, this lecture is for educational purposes only, does not constitute the giving of medical advice, and no patient-doctor relationship is formed.